the Tacoma-Pierce County. I would like to call to order the Tacoma-Pierce County Board of Health for study session. Today is March 18th, 2026. The time is 3:01 p.m. And I'd like to ask the clerk to call the roll.
Board Chair Hitchen,
Here.
Vice Chair Bushnell,
Excused.
Board Member Herrera,
Excused.
Board Member Mello,
Excused.
Board Member Olson,
Here.
Board Member Ryasich,
Here.
Board Member Sadalge,
Excused.
Board Member Yambe,
Here.
Alternate Board Member Cook, Alternate Board Member Ayala, Alternate Board Member Diaz, Alternate Board Member Merrick.
Here.
Thank you. That completes roll call.
Thank you for attending, and appreciate all that are here this afternoon to get an update on an upcoming action item that will happen at our next regular board meeting, along with some new ways of thinking about how we share data, which I'm pretty excited about. So we will start with item number 3 on our agenda, which is the introduction of our 2026 spring budget amendment. We'll start with Director Reed with support with J.B. Paulson.
Good afternoon, Chair Hitchen, Board Member Resizich, all that are here. I am Chantel Harmon Reed, Director of Tacoma-Pierce County Health Department. Our Finance Director, to start off, is want to notify everyone officially. We received notification that our Finance Director, Ingrid Payne, is leaving the department on March 27th. And I will be filling in as the interim Finance Director as we work to fill that position. So that's why you have me here today. Today, I'm joined by Jamie Paulson, our Fiscal and Budget Manager, and we're going to give you an overview of our 26 Spring Budget Amendment. This is our first 2-year amendment as we plan further ahead. Previously, we have amended 1 year at a time, so these numbers will appear larger as we're doing 2-year amendments versus 1-year amendments. So I just want to make sure that you all have that in the parking lot, just as a reminder. I know when we went through the Finance Committee, when you look at some of the numbers, they look a bit skewed, but think of it in 2-year terms. Next slide. So today we're going to walk through the 2026 amendment summary, 26-27 amendment summary. This is our first opportunity to amend the biennial budget that was created in May of 2025. So all of the changes that have occurred between that time frame will reflect here. And we've captured several different things that you've heard over time, some of the federal changes, some of the state changes, and certainly more to come. We're going to begin with an overview of our revenue and expenditure categories, and then dive a little bit deeper into the division details. Next slide, please. So the bottom line up front, we have about a $5.7 million increase over the biennium. There's $3.9 million in revenue in 2026 and $1.9 million of revenue in 2027. The primary drivers of these changes are the growth of the street medicine programs. We were awarded I don't have the number off the top of my head specifically, but we were awarded a grant for the street medicine program from Pierce County to expand the services from us just performing those options just in Tacoma to now all over the county. There's also been a continuation of the septic and operations and maintenance grants from Pierce County. We also adjusted the fee forecast and adjustment for environmental health. Noticeably, there is going to be a shift in our foundational public health services dollars. So you see this number a little bit larger right now. This session ended on last Thursday, and we are in the process right now of navigating what those reductions are going to be like. Currently, the reduction for this year that we are in right now, the first half of 2026, is going to be $2.2 million that we have to share across all local health jurisdictions. So each one of the jurisdictions are going to take their portion of that in relation to population size, complexities, and all those other different factors. But next year, starting July 1, there is a $21 million reduction. So the number that you see here is in preparation and bracing us for those impacts of foundational public health service dollars reductions. There are some additional reductions that we are expecting over the course of the time. You'll hear more about them as it's being presented today. Next slide. So those are some of the things that you've heard. Let me tell you some of the good news that is not reflected here in this presentation. We finalized this budget, I'll say probably in the last week. Yeah, in the last week. Even since that time, we've received an additional $2.6 million in federal congressional spending dollars for our street medicine expansion. Very, very excited. Huge thanks to Senator Patty Murray for securing those funds here for Pierce County. We were also awarded a $924,000 grant from our funding from the Washington State Legislature for capital improvements. We have more details to come. We're going to be presenting that during Public Health Week, talking about what we plan on doing with those dollars specifically. And then, of course, we have the FEHS adjustments that are not reflected in this budget today, but are going to be reflected in our fall amendment. We also have some late breaking adjustments that are not reflected here because they came after we presented and got this approved from the Finance Committee. But we also are receiving an additional $665,000 from the Puyallup tribe for smoking cessation and prevention efforts, as well as an additional $523,000 from the Balmer Group for our Strengthening Families Division. So 2 additional pickups even after these changes were done. You should expect to see these changes in our fall amendment, but you'll hear more updates as we come and as we present more information about these programs. I'm going to now turn it over to Jamie Paulson, who is our, again, fiscal and budget manager.
Good afternoon, Chair Hitchin, members of the board, Jamie Paulson, fiscal budget manager. Go to the next slide. Awesome, thank you. Since beginning, budget additions to permits and fees and Pierce County restricted categories account for the biggest changes, although federal, state, and city of Tacoma also have modest increases. You can see the green columns represent our proposed spring amended budget at a higher level for most categories. Next slide, please. As Director Reed shared, the purpose of this amendment is to align the budget with financial and operational changes that have occurred since the original budget was developed in May of 2025. This is our first opportunity to capture all the changes since we adopted the 2026-27 budget. These changes will accurately reflect our current projections for revenue and expenditures and address any changes to program needs. This includes new grant revenue, loss of grant funding, updated fee revenue forecasts, fiscal year adjustments, and then also our class and compensation implementation. Next slide, please. The beginning biennium budget was $102,899,820, and with the spring amendment, we are proposing to increase our budget by $5,787,760. Therefore, our proposed new biennium budget would be $108,687,580. This includes changes in grant revenue, truing up our fee revenue forecast, and some shifting of grant and FPHS revenue as allowable between 2026 and 27. This amended budget also includes an overall reduced use of Title 19 funds. Next slide, please. Here are the numbers broken out by division. As you can see, we're estimating an increase in most divisions, with the exception being disease prevention and management. And we'll dive into the details later in the presentation. Next slide, please. Thank you. This slide shows our revenue categories and their percentage of the amended budget. The green slices show our flexible revenue. It comes from the county, city, state, and Title 19 administrative claiming and makes up 17.5% of our total budget. The yellow slices are our restricted revenue, or those funds that require deliverables to receive payment. They come from federal, state, including our foundational public health service dollars, city, county, and local sources, and make up approximately 40.5% of our budget. The orange slices show permits and fees and other financial sources, and this category makes up 42% of our budget. This slide shows our expenditure categories, the largest section always being salary and benefits, which currently accounts for 75%, with other services and charges coming in at around 9%. Here is a breakdown of the spring amendment adjustments. From the original budget, we are looking at an overall increase to the budget of 5.6% over the biennium. The detailed changes to the divisions will be presented by each division director. So at this time, I want to invite Environmental Health Division Director Jessica Gailey so she can share the specifics about her division. Thank you.
Good afternoon, Chair Hitchen, members of the board, Jessica Gailey, Environmental Health Division Director. So just as a reminder, last year we went through a comprehensive fee study, which resulted in a reduced reliance of foundational public health dollar funds and needs in environmental health, and also reduced our use of fund balance to cover fee revenue gaps that showed up in almost all of our program areas. The fee study project resulted in an increase in some fee types and a decrease in others. We also made adjustments to our fee amounts as we looked at the data for how long it takes us to accomplish a particular fee-supported activity and the costs associated with them. These adjustments in our fee rates are included in the numbers that you're seeing on the slide. Also captured in these numbers are fiscal year adjustments for grants that span across multiple years and foundational public health services that are on the state fiscal year cycle that splits across calendar years. The increase of just over $1 million in on-site sewage and drinking water is largely due to grant funding that wasn't yet confirmed when we originally developed this budget in spring of last year. And while we do rely heavily on fees to support the work that happens in this program, we also rely on grant funding for focused activities in particular areas around the county, like Key Peninsula, Gig Harbor, Puyallup River watershed, and Lake Tap. So other watershed areas around the county, and then particular bodies of water that we're interested in having improved water quality. So a huge thank you to Pierce County for your continued support of the septic operation and maintenance activities. We see it working, and this helps keep our drinking and surface water resources healthy while also reduces maintenance costs for homeowners and allows them to access some savings through our financial assistance program. So these funds allow us to do that. The $20,000 increase in waste management is a combination of adjusting our fee revenue that I described earlier with updated information and then adjustments to grants that span across multiple years. The $121,000 overall reduction in revenue from surface water is a combination of grant funding amounts that weren't yet confirmed. So we knew we were getting the money, but we didn't quite yet have the exact number. There were slight adjustments in some areas there, and fiscal year adjustments for funding that spans across multiple years, and a reduced reliance of our use of general FPHS funds that come into the department. Our food and community safety program saw the largest increase in fee revenue with the adjustments to our 2026 fee schedule. During the fee study project, within this book of work in this program, we discovered several places where we weren't really recovering the cost of fee-based work, and we were plugging holes with other funding types. So in order to make that whole, we made some adjustments in those fee types for this year. This allowed us to reduce our reliance on general FPHS funds in this program as well and make those available for other uses around the department. And then lastly, the reduction of just over $850,000 in our natural and built environment program largely reflects another reduced reliance on general FPHS funding. This program was formerly known as our Social, Economic, and Environmental Conditions for Health program. If natural and built environment isn't ringing a bell, we did a rebrand of that program at the beginning of this year to just better reflect the work that's now happening in that program. Since we've talked a little bit about some federal funding, I just wanted to remind you all that some of you might remember in 2023, we received a $1 million grant from the Environmental Protection Agency for some focused wildfire and wildfire smoke prevention work around the county in the years of 2024 to 2026. So we found out about that early in 2024. We're able to incorporate that reduction in the original development of this budget. That is not reflected in this number. I know it was a large amount that we've talked about that was pulled from the health department, and that was kind of baked into the original amount. So if anybody was wondering about that pot of money. That's it. Happy to answer any questions.
Thank you. Are there any questions on the environmental health budget? I'm going to take silence as no, so thank you.
Hi, good afternoon. Chair Hitchin, members of the board, Natasha Holbert, Division Director for Disease Prevention and Management. Over the biennium, Disease Prevention and Management Division has an overall loss of revenue of approximately $288,000, the bulk of which is due to a loss of federal funding. For immunization and provider engagement in chronic disease, we received an additional $12,000 through a cardiovascular disease grant, an adjustment of approximately $9,300 for our dental initiative between 2025 and 2026, and a loss of our federal SNAP Ed grant of approximately $583,000. For STI HIV, we had a reduction in Max Clinic and HIV federal grants, and adjusted for a grant that we anticipate but have yet to receive. This is a reduction of approximately $156,000. In general disease investigation and TB, we received additional funding for respiratory virus hospitalization surveillance and grants for both TB and refugee health that were higher than originally budgeted, an adjustment of approximately $146,000. In public health, emergency preparedness and response, we were able to carry forward funding of approximately $242,000 from 2025 to 2026. And for COVID-19, we received a grant of approximately $43,000 to support community outreach efforts. Do you have any questions for me?
Any questions? Not seeing any. Thank you.
Thank you.
Good afternoon, Chair Hitchin and members of the board. Melanie Lopez, the Strengthening Family Divisions Director. All information is from our biennial budget of 2026 and 2027. Our Title 19 coordination, this was funds moved from Title 19 revenue to this cost center to cover some of the increased costs. It doesn't represent an actual increase in revenue. Next up, our Family Support Partnership. This was a net loss of approximately $22,000. This was largely due to a loss of our diaper bank grant, which was almost $200,000. And so that is the difference, or not the difference, excuse me. That is the main reason why we had a net loss in this year. For our behavioral and emotional health, this also was a net loss of $255,000, $280,000. This was largely due to the loss of the child wellness grant from Pierce County. That said, we did receive an increase in state youth substance use prevention funding, which was the amount of about $285,000. And we also, as Director Reed just mentioned, included in this was an increase estimate of rollover of the Puyallup tribe funds. But as of yesterday, we received an additional approximate 600,000 in addition to that. So these numbers will change. But again, this was information that we received yesterday. So that reflection is not here yet in the emotional and behavioral and emotional health line item. For treatment services, our public health clinic, we did have a net gain of about 2.1 million. With our treatment services, there was a gain of about 88,000, and then also an increase in FPHS funding for special projects, and that was for 2026 only. Additionally, part of the public health clinic, street medicine, as Director Reed had mentioned, this is a net gain of just over 2 million. This is an increase based on the extension of the City of Tacoma funding, which was originally budgeted for $1 million, but we are now at an award of $1.4 million from the city. And we also are receiving additional funds from Pierce County at approximately $1.6 million as well. And also not reflected here in this particular slide is the appropriations. As Director Reed had mentioned, we are going to be receiving approximately $2.6 million in appropriations from Senator Patty Murray, which is, again, not in the budget. We will add that to the budget once we have a little bit more information and details received on that. Finally, our parent and child family health. As you'll see here, there is a net loss of about 88,000. This was largely due to what we thought was going to be a reduction in our Balmer Group grant that is going to be or was going to be ending at the end of September. That said, again, as of yesterday, we had additional news or recently received additional news that we are going to be receiving an additional $500,000, a little bit more than $500,000 in additional funding from the Balmer Group for our parent-child family health, and that will extend the contract that we have with them through March of 2028. So again, more late-breaking news. So this number, those numbers will be a positive the next time that we meet once those numbers are reflected. Any questions?
Thank you. I'm pausing to see if anyone has questions. The opioid task force work falls under the behavioral and emotional health. Is that the line item where that lands? Okay.
Yes.
Not seeing any hands, so thank you.
Okay, thank you.
Good afternoon, Chair Hitchen, members of the board, Sinden Jitsi, Deputy Director. I'm going to walk you through the updated budget amendment for our 4th Division Administrative Services. So you can see at the bottom of the table that we had a total increase of about 3.2 million for this division. Most of it is, as you've heard from the other division directors, fiscal adjustments with our foundational public health services funding. So either funding that we didn't spend in the first half of the state fiscal year that we're going to move over into our budget, or maybe we spent more than we had anticipated, so we're going to take some back. And so that's true for the Office of the Director. We have a foundational public health services adjustment of about $4,000. Same with business support services. That's where we spent more than we had anticipated. So there's a reduction of about 16,000. For human resources, the good news is that we received an additional grant. It's the CDC's Public Health Infrastructure Grant. And so we received an additional $200,000 for that. We use that money to promote workforce development at the health department. So we use that for recruiting activities, internships, volunteer opportunities with the health department. And then there were some other fiscal year adjustments as well. For information technology, we had a minor adjustment, but then more good news. We received a new grant for about $100,000 for cybersecurity. In assessment, evaluation, and epidemiology, that's again a FPHS fiscal year adjustment. I'm going to skip over general FPHS for cross-cultural collaborative initiatives. That's also a fiscal year adjustment, foundational public health services funding, and then same way with internal services, it's a fiscal year adjustment. For the general FPHS category, I wanted to make sure you knew this is not new foundational public health services funding. This is just a different way of showing it in our budget. And I'm happy to take any questions.
Any questions on this one? Not seeing any, so thank you.
Okay. I think that's it. I believe that's the end. Yeah.
Okay, then I do have like a general overarching. We heard several different items are changing. When we see this in April, will those changes be reflected, or is this what we're going to be presented and voting on?
This is what you're going to be presented to and voting on
Okay.
in April. Yeah, because the way it has been done historically, right, is that we present this to you in Finance Committee so that we can delve into some of the very nuanced changes, and then we come to the full board for a vote on your acceptance of it. This is so that you can ask questions that dive very deep into the explanations that we've given you here. We probably will not go into as much of an explanation at the April 1st meeting, but it will be the same information here. Unfortunately, the numbers that we mentioned, like all of the other grants that we receive, won't reflect here because it won't have the opportunity of going through the vetting of Finance Committee to hear a study session for question and then full voting on the board. So,
Okay.
yeah,
Just wanna
unfortunately.
check.
I know,
A lot of-
unfortunately. I
lot
know
of
we want to get it
exciting
in too.
news and- So,
I
okay.
know.
Any other questions from colleagues just in general on this one?
I would just like to say I'm amazed and impressed at how well you guys keep track of all these moving pieces.
Mhm.
This would drive me nuts.
Thank
So thank you and congratulations.
you. Thank you.
Okay, well, thank you.
Thank you.
So we can get to our next item, which is a presentation on core indicator dashboards. Love data dashboards, everybody, so I'm very excited. We have an entire team coming down and some special guests.
Hello, good afternoon, Chair Hitchens and members of the board. My name is Dr. Shanice Owens. I serve as the Director of the Assessment, Evaluation, and Epidemiology team here in the Health Department. And today we're really excited to engage with you in a brief user testing experience for our newly developed core indicator dashboards. And these dashboards really represent an important step in how we plan to use and share public health data across Pierce County. Next slide, please. So as a reminder, one of the key strategies within our 2025 through 2029 strategic plan is to develop publicly accessible dashboards for our core health indicators for our communities. The intent really behind this work is to transform complex public health data into information that is transparent, accessible, and actionable. So really to help support decision-making, not only for you, our board members, but as well as community partners and residents throughout Pierce County. Thank you. This work has been and will continue to be highly iterative and collaborative. We began in early 2025 by identifying and finalizing a set of core health indicators. And then from there, we moved into dashboard design and figuring out the technology around how we would make this work. In the late 2025 time period, we conducted user testing with our leadership team, which was a lot of fun. And that really directly informed how we redesigned some of the dashboards and improved our usability and clarity of use. By the end of 2025, we had developed our first set of dashboards internally. And earlier in this year, we launched them publicly, which is on our website, which you'll get to see today. That said, this still isn't a finished product. It's an evolving system, and we will continue to do user testing like with you all today. And those of you online will also be able to participate. We will incorporate that feedback and redefine the dashboards over time. Our goal is to ultimately publish all 70 core indicators within the next year or two, and then continue to do ongoing enhancements until 2029. We are committed to building tools that are not only accurate, but also meaningful and usable, but also sustainable for both our internal teams here and the communities we serve. I will now turn it over to Dr. Freiberg, who will walk you through the development process and talk more about the categories in detail.
Thank you, Dr. Owens. My name is Ingrid Freiberg, one of the epidemiologists here, and thank you very much for letting us present. One of the things that I think is really important about this dashboard process is that it hasn't been very siloed. It has actually been very iterative and very collaborative. We have worked with 4 different groups within the health department to really try to bring these together to the best of our ability. The initial indicators that we're going to be putting onto those dashboards were determined by the assessment, evaluation, and epidemiology team based on scientific reasoning. However, we know that we needed everybody else to make this succeed. What we did was we had weekly meetings for about 6 months to discuss the needs of everybody involved. What that meant is that we worked very closely with our Bridging to Community team to get their perspectives on what would work for the members of our community. We also allowed our information technology team time to learn the technology and figure out how to actually safely and effectively deploy the tools that we had. And after all of these meetings with everybody conversing, we ended up having our communications team develop a very nice template that we can use to move forward. It's still going to be a work in progress as always, but it's still very good. And we've previously shown you the mock-ups of how we wanted everything to look, but today we're actually going to be able to show you what it is. Next, please. But before we get there, I do want to remind you of what we're talking about here. We have about 70 indicators that we have selected to be included. They included basic demographics such as age, sex, race, and ethnicity. We've really considered the health issues that affect Pierce County residents on a regular basis, ranging from infectious to chronic disease, mental health, substance use. But we also have a lifespan approach within the health department. What that means is that we have to consider pregnancy and childbirth all the way through death and everything in between. We also need to consider what's going on in terms of access to healthcare and all of those interactions because they affect health, along with the factors which lead to healthy systems, such as housing, education, and economic factors. In yellow on our slides, we have 4 categories that are overarching, which are really combinations of the other categories that we're going to be showing. And together, this group of indicators will hopefully describe the landscape of Pierce County residents' health. Next. So here we go. We've redesigned our webpage a little bit, and this should make it really easy to find these dashboards. And in a second, we're actually going to have you guys dig in and test it out and play with it yourselves, because that's the fun part, right? But first, what you can see here is a little box in green, which is highlighting where you can click on the data dashboards. We've made it really easy. You can either click the words data dashboards or the picture, and then it will take you to our landing page. But it's really important to realize that this information is actually super findable. I did a quick Google search, and if you do TPCHD data dashboards, 2 out of the top 3 pages are our data dashboard pages, and the third one is one of the dashboards. So it means that we're actually making sure that people can find us. So that's really nice. Next slide, please. And this is what our dashboard landing page is going to be looking at. As you can see, and as was our intent, it was going to be relatively simple, pretty streamlined. But let me show you a couple of features. At the top left of the screen, you'll see a list of links that you can actually click on. What this means is that no matter where you are in the dashboards, you'll be able to go directly back to this homepage and find what you're looking for. We also know that people have opinions about what's going on in these dashboards. So on the top right-hand side of our page, we have a place where people can submit feedback and ask questions and say this is broken or whatever it is that they need to say. So we really want to encourage people to give us that feedback when they find it. In the middle of the page, we have tiles. Right now, we only have 6 because we're trying to streamline our processes. But in the end, there will be 70 of these little tiles, these little squares, where you can click on one of those to get to your dashboards, which is wonderful. But we don't know that when we have 70 of them, it's going to be a really long list. So people will also be able to search by selecting a category or a topic that's on the left-hand side, or manually typing in the name of what they're looking for. So what we'll do is now I'm going to turn it over to Emily Turk, who's going to talk to you about the user testing and start your activity relating to user experience. Thank you.
Thank you, Dr. Freiberg. Good afternoon. My name is Emily Turk. I'm a senior program analyst in AEE, and I'll be guiding you through a user experience today. But first, I have one slide about user testing, and then we'll start the fun part. So user and usability testing help us understand the user, who they are, and their data and accessibility needs. Usability testing informs our designers of needed changes to improve functionality based on how users engage with the dashboard. We're conducting 3 moderated user tests, one already conducted with the leadership team in December, and 2 more with staff and community partners this spring. In the sessions, we gather quantitative metrics and observational qualitative data. We also have short surveys before and after the test sessions for feedback. Community members will be compensated for their time. And staff, we've been known to provide bagels, pastries, and other sweet rewards for your time and energy. And you get to hang out with us. So get excited to test our dashboards. Don't worry, board members, we're not testing you today. We want to provide you with a user experience to explore the dashboard, click around, and see what's there. So I'll be guiding you with some questions just to give you something to look for in the dashboard. Next slide. Board members in the room, you have tablets here to navigate. If you're on the Zoom or listening to the recorded video later, please follow along with us. And if you have your laptop here in the room, staff members, you can follow along too. Dr. Cam Solomon and Dr. Ingrid Freiberg are here in the room if you have questions. And if you're on the Zoom, feel free to put your questions in the chat and Dr. Owens will help you out. Okay, let's get started. So please go ahead and navigate. You can click on your Edge browser. If you're here in the room, if you're at home, you can click on any browser.
Just for the record, Board Member Herrera has joined us.
Okay. So once you're on your browser, you can navigate to tpchd.org and follow the prompts on the screen. You can select info and then data, or you can just scroll down to the bottom right and click the data blue box. And the first thing we're going to do, next slide, please, is we're going to find the prevalence of adult depression. So go ahead and take a look, click on things. I'll give you just a few seconds or so to look around once you've clicked on the data dashboard. Maybe look up so that I know you're on the adult depression. Okay. All right.
Oh, I can't see my colleagues though.
Are they looking good? All right. Next bullet point, please, Sherry. Okay, so we're going to look, is the Pierce County percent increasing or decreasing over time? Look at the bar on the graph. And you can just call out your answers or put it in the chat.
There is no chat.
Oh, there is no.
So
Oh, okay.
So
They can
I would just
unmute.
ask my colleagues to, because I can't see you because I'm playing with data dashboards, just unmute and yell out answers. We'll be really bad students. Board Member Olson, I saw you unmute.
Well, what was the question? Looks like it's gone up from 26 or from 24 to 26. That's
Yes,
Pierce County over state. So it is slightly trending up, to answer your question.
that is correct. Thank you. All right, next bullet point question. Now we're going to look at the Pierce County percent compared to Washington State. Is the Pierce County percent the same or different than all of Washington? And there's some text above in the gray box that may be helpful.
Well, according to you, it's not significantly higher.
Not significantly higher. Mhm. Pretty similar. Yep. Great. Okay, next we're going to look at Pierce County percent among men and women. So navigate to where you think that those data may be. Is the Pierce County percent higher or lower among men than women? What do you see there?
Definitely higher for women.
Yep, women are more likely to be diagnosed with depression. Okay.
I'm not surprised by that data, by the way.
Dr. Freiberg is saying this is self-reported data. Thank you, Dr. Freiberg. Okay. And the final, you can reveal the final two, Sherry. We're going to look at the map now. So click on the map. Is there a difference in depression rates based on where people live in Pierce County and which areas appear to have the highest and lowest rates? So here you can find the legend on the right-hand side and select the depression percent category with the highest rate. And it'll reveal some colors on your map. And then you can hover your mouse over the zip codes to identify the one zip code with the highest percent of adults diagnosed with depression. I think that's above 35% is the highest. So what zip code do you see, or codes, there's no right or wrong answer, any zip codes with high percentage of adults diagnosed?
98580.
98580, yes, that is one. Any others?
98408.
Yep.
And
saw
98354.
Yes, 98354. I think I saw 98323. And just since we're doing good well on time, what areas have the lowest rates? Do you want to click on the 0 to 15% low? I think it's yellow. What zip codes have the lowest rates?
So 98433, but that's predominantly joint-based Lewis McCord. Is it potential that we just don't have enough data on that one?
Do you want to answer that, Dr.
I
Freiberg?
just, based on what I know about the community that lives out there, I don't feel like it's a low depression area.
So the data itself, we make sure that we have a large enough sample size so that we're not showing things that are too small. If you look at the details, it'll show that this is over a 5-year period. So we actually do have an adequate numbers. However, what we don't know is which people are responding, whether it's the people who are stationary and staying there, or whether when people come in and leave, whether we're missing out on certain populations that are there. So it is a possibility. And even though the data are real, we should always take that into consideration when we interpret the information.
Well, anytime with JBLM, it's a moving target, so.
Thank you. Any other questions or thoughts about the adult depression dashboard before we move on to the unemployment dashboard? We'll have time for Q&A at the end too. Okay. So we'd like to show you one more dashboard. Next, I'd like you to find the unemployment dashboard. You might have to go back to that first page. Once you're there, you can go ahead and click around and just familiarize yourself with that page. And maybe look up once you're at the unemployment dashboard. Yay, thank you. Okay, these data include 16 and 17-year-olds. People have asked why we include 16 and 17-year-olds. Can you go to the data notes on the left where we explain exactly who is included? Is this page helpful? Shows everyone who's included. Okay. And the last question is, where is unemployment highest in Pierce County? So we're going to go back to the map. And these are by census tracts, so you may have to guess. I always have to guess at the areas. So what are some areas where unemployment is highest?
Which makes no sense.
Anyone want to share an answer? Unmute or share in the room.
So Parkland, Midland.
Yep.
The Bonnie Lake area, which I don't understand, but again, it's interesting.
Okay.
Tacoma.
And you're on a cell phone, so that's interesting. Yeah, the user experience will be different. Mobile testing staff, bring your mobile devices. Well, that is our last question. So we'll just transition to Q&A, suggestions, and feedback.
Okay, let me turn this off, otherwise I'll be a distracted student. Board Member Olson.
This is really kind of a in the weeds type of question, but I'm just curious because you shared some depression data numbers. Was there, it said that women were, I think, 33%, 18% for men. Was there any differences in between 2019 and 2021, pre-COVID, post-COVID, with isolation and social distancing? Did it affect one or the other to a greater extent?
I'm going to let the
Just
doctors in the room
curious.
answer that.
Well, one of the things is that if you look at the very front page, you can see the trends, but we have not separated out the trends by the gender of the two populations. What we've really tried to do is look at the overarching values. And from what I remember, which isn't going to be on the dashboards because it's too far into the weeds, is that it is equally affected during the 2020-21 period. And we sort of I don't want to say gloss over it, but we get averages and look at 5-year averages to show most of our information. So I don't think it's more affecting during that time. The other thing to realize is that that particular piece of information is a multi-year average because we get a relatively small number of individuals. And so looking at the subcategories is not always the easiest. However, there is another tab on our dashboards called Interactive, where you can look at some of the comparisons and some of the subcategories, but it still will not be able to tell you which one was affected more or less in 2020. It will just look at, for example, things like men and women versus ages and things like that.
Okay, thanks.
You're welcome. Here for other
Additional questions or feedback? So I know mobile testing.
I was going to say, I think it's cool. And it is going to be relatively easy to look stuff up in this once you play around with it a bit and get used to it.
Thank you.
I keep turning off the screen so I can see other board members. So I guess feedback from me, really appreciate the mapping aspect of this. I think there's a lot of work that we're doing both regionally within the county in lots of different stakeholders that are constantly looking at census tracts and trying to figure out where are we missing the mark as far as investments or what populations need maybe additional supports. And this will just give us one other way of looking at populations. So appreciate that many of these have that map feature. I do wonder about the JBLM data and how to tease that out a little bit, and or maybe it's something we need to think about. Like this is JBLM, subject to interpret. Like I don't know how to word it. And then I think really appreciate the really clear, like how do I get back at the top? It's not super busy, which makes it easier to work with. But my last question is the data is only as good as it being updated. So what's the intent with so many different dashboards to kind of keep them up to date and moving forward?
Yes, that's a really good question, and it's something we've been thinking about. So right now, we're just using these as the first round, but in the long run, there will probably be something like 15 dashboards from the same data source, from Burfus, which is this particular data set. So we plan on updating that one on an annual basis.
Okay.
Some of our data sets are going to be from the Healthy Youth Survey, which is only updated every 2 years. So one of the things we do intend to have is a note at the bottom of the page which says, this is when it was most recently updated, and this is approximately how often we intend to update it. Almost nothing will be updated more frequently than once a year.
Okay.
Because we don't want to, it's going to be a lot of work, but we're developing systems to make that as straightforward as possible.
Okay.
And I will just say, part of the reason why we are taking such a long time to build out the 70 core health indicators is that we are working really closely with our IT team, as well as hoping to bring on a data scientist within the next few months who can help us with automating and kind of using some informatics technologies that will let us not have our epidemiologists constantly kind of iterating and updating these data, which can take a long time. We are a small but mighty team. And so that will take some time to make sure that we can utilize models that allow us to automate these dashboards so we don't become a government website that's out of date with our data. We do not want to be that. So we are taking the time that we need to make sure we're doing it right, but also to make sure that it's automated and efficient.
Okay, and then the last one is just appreciate the data notes that's on each of these. It's clear. It's and I know to look for it. So if I have questions, which is again one of those things, like if it's not thoughtful or different teams have put them together, if you're on dashboard sites, you'll be like, it's over here and it's over here. So it's very consistent. So if you're looking for data, you know where to look, you know how to navigate, which just makes it very clean. So well done. Really, really very impressed. Thank you. Any other questions from board members? I saw you come off camera, board member Herrera, but it might have just been I pushed the wrong button. Okay. Is there anything else to chat with us?
Thank you for letting us present this, and we're looking forward to rolling out more.
This is public now, so like if I wanted to send it out in like one of my newsletters and go look at this cool new tool. Okay.
It's a public link. It's on our website. You can access it at any time. And I think once we start rolling out more, we will probably just have our comms team put out a newsletter. But the site is live and public, and we're working, in general, we're working to update the site to make reports, and we'll be putting our community health assessment, which will be coming out this year, on that website as well. So we're making it just clean and accessible for community members to identify what they need from us, our assessment, evaluation, epidemiology team. So we're looking forward to rolling out more soon.
Okay. Well, thank you.
Thank you.
There was an email on the very last slide too, an AEE public email that anyone can email suggestions and feedback to.
Okay. Perfect. Well, thank you to the team. Appreciate the overview. We do not have an executive session today, so going to check and see if there are any other comments or announcements from board members. Not seeing any, so seeing no other work before us in study session, we are adjourned. Thank you, everybody.